These are my disclosures. The purpose of our small study was to seek a rationale in using low-near at EDOF in dry HRMD with pigment epithelium detachment and impending neurosensory detachments. The design of the study was 20 eyes, 10 eyes was with Lentis EDOF lens, 10 with monofocal aspheric hydrophilic yaw. Pre-op exams was best corrected distant visual acuity, uncorrected distant visual acuity, uncorrected near visual acuity, and best corrected near visual acuity. Biometry, of course, OCT, and autofluorescence. Post-op, we check the same parameters. And this is our first patient. This is dry macular degeneration with confluent drusens. The vision post-operatively was really surprising for us. But the autofluorescences show that the pigment epithelium is still with his potential of giving vision or to support the photoreceptors to function. That is why the autofluorescence, I think, is mandatory in that cases. This is the other eye. Here you can appreciate the line of the pigment epithelium and the photoreceptors above them. This will be important to explain our theory with the EDOF lenses. This is the impending vitelliform maculopathy. Again, patient with surprisingly good, best corrected near visual acuity. This is the autofluorescence. Again, the autofluorescence. Okay, we see some minor changes. We see the impending detachment of the neurosensory layer, but still, this is an eye with good function. And this is one patient on which the worst eye we have choose to implant the Lentis Max. In the other eye, we implanted a Lentis Comfort. And the patient was really happy. Why this autofluorescence is important? Because maybe here we have islands of still functioning pigment epithelium, which gave the option of this eye to see. So our results, all eyes implanted with low near at enhanced depth of focus yaw Lentis Comfort showed significant improvement in best corrected near visual acuity compared to best corrected near visual acuity of the monofocal aspheric group. The uncorrected near visual acuity of the EDOF IOL group was significantly better, and the image distortion in the EDOF group was lower than the monofocal group. The uncorrected distant visual acuity and best corrected distant visual acuity found in both groups were similar. No change in the posterior segment condition was noted during the observation period, which was 6 months. Our idea: the photoreceptor plane in macula is not a flat line when there are pigment epithelium detachments or neurosensory detachments. That suggests different focal points for individual photoreceptor, leading to less photoreceptors with optimum focus and more distortion in the image when monofocal yaw is used. The low near at Lentis Comfort could potentially engage more photoreceptors with optimal focus, despite they are on a different z-axis or vertical plane, leading to potentially better image with low distortion. When we combine the EDOF with superimposed near over far image, we can hypothesize that we can have X, Y, and Z image augmentation. The superimposing of the far and near vision images creates higher image density in terms of more focal points projected over the macula and X and Z axis, which potentially leads to better image perception despite the compromised structures. So our conclusion is that this case series can be initial proof of concepts for YXZ image augmentation phenomenon provided by Lentis Comfort. However, the limited number of patients in the consecutive case series study can be used for hypothesis testing and cause and effect estimation, but it can be influenced by selection bias, Rosenthal effect, Hawthorne effect. So further investigation and randomized control study will be need to clarify this concept. Thank you for your attention.